Brilliant. Okay, thank you for kind of watching Brandon's story. And before we talk more in terms of Brandon and how you feel about it, what I want you to do is think about what factors do you think may have had an impact on Brandon's healthy child development, and could you share your thoughts with us? Please, could you raise your hand if you and tell us what you think, or you can post your responses in the chat. So what do you think may have had an impact on Brandon's healthy child development?
So we've got neglect, lack of secure attachment, domestic abuse, attachment issues, maternal mental health, absent father, linking feelings of anxiety with sexual behaviour, domestic abuse. Yeah, does anyone that's posted in the chat, does anyone want to pop their hand up and elaborate a little bit? Again, we're not going to pick on anyone, so don't worry. Tracy?
Yeah, one of the things I was looking at was sort of like, as you go through Brandon's story, you've got the elements of neglect, which are early doors. You've then got the the second child, you've got a history of domestic abuse. You potentially, we don't know enough about what what it is that Brandon's dad's been doing, or why there's sort of like issues around there. But then you've got the learnt behaviour, the copying, the exposure to adult pornography, and he's sort of like growing up thinking, well, this is how you get over arguments or sadness. This is what you do. They were my thoughts about it anyway.
Great, thank you, Tracy. Yeah, absolutely. Is there any more comments in the chat, Wayne?
Yeah, there's loads actually. Sorry, I was listening to Tracy and then I kind of lost track a little bit. Yeah, someone's mentioned obviously the pornography, the presence of pornography within the home, witnessing violent exposure to inappropriate sexual behaviour. Someone's put things happening to him when he was such a young age that he won't be able to remember well or communicate directly as an adult, which I think is an interesting one. He can't build a picture of his own innocence.
Yeah. Brilliant. Thank you. Yeah, there's so much going on for Brandon, and has been since birth. And this is just to summarise all of which you have covered within your responses. So, that there's so much going on, that inappropriate access to pornography, games and films, that maternal mental health and maternal rejection, so that neglect element, lack of positive sensory experience, so kisses and cuddles in an appropriate way. So loads of stuff going on, but thank you so much. You came up with far more than we have on here, so that is really great. Suppose just a question before we go into this and talk about research and things is, so how do you feel about Brandon? And really looking for someone again to pop the hand up. So how do you feel about Brandon? Do you recognise him in terms of children and young people you've worked with? And then in an ideal world, what should happen to Brandon? What should happen for Brandon now? So if someone would like to pop the hands up and share their thoughts, or again pop in the chat, that would be great.
Support for Brandon so he can understand things.
Yeah.
Thanks, Catherine. Support, listen to his voice, SEMH support, referral and assessment after a strategy meeting.
Yeah.
Sally says they feel sad for Brandon. Someone suggested early help. Someone said that there are there are clear flags that need to be addressed by professionals. Referral, intervention, work around healthy relationships, sexual boundaries, consent, work with parents as well.
Absolutely, yeah, and that's an important part. Yeah, and that's an ideal world scenario, isn't it? That we'd want We'd want that support for Brandon. We'd want all those things that have been mentioned. We'd want support for Mum as well in terms of her mental health and her parenting. So absolutely all those things. So this is a rhetorical question, but just something to think about is, are you all confident that for all the Brandons or all the children and young people displaying harmful sexual behaviour in North Yorkshire, are they all getting the ideal scenario response? Are they all getting that support, that intervention that they need, the support for parents? And when we talk to areas and professionals, the vast amounts of time the answer will be no, that not every child gets that response or that support and intervention you need. And that really kind of just highlights why we're here today. Because we want to work towards every child being able to get to what they need, but also the professionals who work with them to be supported to be able to help those children and young people. So that is exactly what this process is about, exactly what the audit is about. So we just really want to emphasize that, you know, that consistency in terms of response for those children and young people is kind of what we're working towards. Thank you everybody for kind of sharing that section. I suppose a couple of extra things to know is that what do we know? So a study by Hackett of children and young people with HSB suggests 2/3 had experienced some kind of abuse or trauma. In our experience, domestic violence can be a real key thing that a lot of children we have worked with that is prevalent in their backgrounds. Around half of them had experienced child sexual abuse, but kind of important to note, which we touched on earlier, is that most individuals who are sexually abused children do not become kind of perpetrators of child sexual abuse. Other things we know is that most young people coming to the attention of professionals are male, and the peak time is around that onset of puberty. Young females actually make up a small minority of those who display harmful sexual behaviours, but those who do have a higher rate of victimisation in their childhood and more likely to have experienced abuse in their background. And what we know is that young people with additional learning needs are quite a high proportion of children who display harmful sexual behaviours. And touching on that, so for those younger children that are under 12 to display those problematic and harmful behaviours, it's likely that their natural healthy sexual development has been disrupted in some way, so they are more likely to have experienced sexual abuse. However, the behaviours that the younger children display are more likely to sit within the amber rather than the red in terms of the continuum of behaviours. And then children and young people with learning needs are more vulnerable both to being victims of sexual abuse and to displaying problematic or harmful sexual behaviour. In our experience, we've had lots of children referred to us who've got diagnosed or undiagnosed learning needs, and often if they're undiagnosed, they need to be assessed first to ensure that whatever intervention or support we provide is appropriate. And it can be quite challenging for those who work with children to kind of manage or respond to harmful sexual behaviours from those children who have additional learning needs. Okay, does anybody have any questions or thoughts before we go on to very specifically talk about the audit and the process and what the HSB framework is? Oh, Tracy.
Yeah, so sorry, you might have answered this question earlier and I might have missed it. The Brandon's video, I'm responsible for trying to raise awareness of harmful sexual behaviour within the police, making sure our frontline cops identify it, and then obviously going into the detectives and stuff. I just thought the Brandon story was really good, and we have like a bite-sized learning that we can launch it on. Are we able to have access to the Brandon story so we can use it as a learning point?
Unfortunately, we aren't able to share it. That's why we had to stop the recording, because of the IP link to the video. However, we can share other things that we've used or other things that are available. So we can do that, and then you can see what else we have that might be helpful.
Lovely, thank you.
Tracy, any questions coming out in the chat, Wayne?
No, there isn't. Kerry said often the response to HSB is left to the schools, which I think is an interesting point worth mentioning. But yeah. No questions as such.
Yeah, and I think it's a really good time to say that's why education's role is so important. It's so important that teachers and staff within schools get the support they need and the training they need to be able to respond appropriately. But it's all about kind of the whole system as well. We know that schools hold a lot of the kind of responsibility around that day-to-day management of these things, and it's why education plays such a crucial role in this audit process that we're going through. We really need to hear what education's experience is. So yeah, absolutely, such an important point. So in terms of the harmful sexual behaviour framework, so gosh, it was about 10 years ago now, the NSPCC initiated the kind of coordination of a group of organisations and independent experts, academics, research partners to come together to look at harmful sexual behaviour. And it was really acknowledged that there was a huge gap in this area in terms of that systematic approach, so that holistic approach from all the way through to from prevention to kind of intervention and support. So it was really acknowledged there was a huge gap and a real lack of consistency in terms of the response. This is nationally, it's not in any particular area, it was a national issue. So it wasn't just us, there was lots of others involved, as you can see from the slide, and what we had is 14 local areas involved in a practice working group, so that feedback, and we piloted also the audit process and the framework with those 14 areas. And as part of the pilot, and doing it with those 14 local areas, this was the feedback, and this was pretty consistent across the board in terms of the issues that it brought up. So there was a lack of appropriate training and support for staff across the agencies. There was really inconsistent responses to allegations regarding harmful sexual behaviour. It was very dependent upon, certain individuals knowing more than others, or some being really good at responding. So it was very inconsistent. So poor clarity around any communication or sharing of information following an allegation, and a real lack of shared language and understanding across the board. And that from a service delivery perspective, there was a real need for that joined up thinking across the multi-agency teams, for assessment, but also for that intervention and support as well. Often when we show this slide, if I could see your faces, I'm probably getting some nods and thinking, oh yeah, that sounds quite familiar. We recognise some of those as issues in our area. So it's still 10 years on, seems to be very reflective of what areas are telling us now as well. So that's, that's helpful. In terms of the aims of the audit, consistency is key. So what we're looking at is kind of the whole picture, like I said, in terms of from training and development work for staff, all the way through to policy, through to response, availability of services, criminal justice response. We're looking at the whole picture, and what we're aiming for is that consistency. And through the audit process and then working on your action plan, that's what we hope you're going to achieve in North Yorkshire. And critical to that, which is why it's so positive to have such good representation here today, is involving partners, because it really does kind of take a village. Not one organisation can do this or make these big changes or create this kind of consistency around HSB provision and response on their own. And no doubt as we go through the audit process, there'll be pockets of excellent practice that happen in North Yorkshire whilst working with children who display harmful sexual behaviour. But that service or that school who do a great job can't do it on their own if those other things aren't around. So you might have a school who provides excellent RSE support, resources, lessons, talking to children about healthy sexual development, healthy relationships, how to identify any concerns. But then if the referral pathways, if the structures aren't in place for them to refer out to, there's no support, there's no sort of intervention at all available, then things are inconsistent, and it kind of so what we really need to do is really work together across all the agencies to look at what we do, map it out, and really kind of draw out those elements of really good practice, and also identify where there are gaps as well. When we work, this is 6 months of work with us and the North Yorkshire Safeguarding Partnership that's happened so far. We started talking back in July. And that's why we do go through a process with anyone, any area that's going to undertake this audit, to make sure that all those things are in place so that we do a good job, so that it's worthwhile for the area. Because all these things on the slide in terms of confidence to take the process forward, understanding of the process, that engagement and buy-in, which is clear you have in North Yorkshire, and that leadership and ownership, all these things need to be in place beforehand to make it work really well. Because we could, we can all develop the best action plan in the world. We need then for the leadership teams to be able to own it and make sure it's kind of followed through on. And again, findings from what the actual audit does kind of achieve from our experience is ultimately at the end, we'd look for you to have clear policies and procedures, and that would be included in our recommendations and in the action plan, which would help you set up an operational framework to refocus the agenda around harmful sexual behaviour, linking with child sexual exploitation, so that local practice can be refreshed and practitioners can be upskilled to feel confident to deal with and respond to harmful sexual behaviour. It's a platform for that reflective practice. So again, like I just mentioned, we're looking at the strengths and areas of good practice. We're looking at any gaps in provision, and any kind of innovations that take place. When we go through this process, there has not been one audit we've ever done where people have not had a moment where they thought, oh, I didn't know that happened. Oh, that's great to know about that. So really just drawing out all those local things that take place is really kind of welcome, and thinking about how we can improve what we do currently. So that multi-agency approach is key, and that it can be used as a persuasive device. So if there's hope for any funding to be secured locally, to kind of maybe commission services or training, and really engage partners in terms of, what you can do, you'll have a really comprehensive report with recommendations and an action plan at the end of the process. The HSB framework itself is split into 5 sections or domains, and they range from, number 1 is around responses. So what's the response like to children and young people displaying harmful sexual behaviour? That also includes things like data capture, if data is captured around harmful sexual behaviour. There is prevention and identification and early intervention. What does that look like? There's assessment and referral pathways. So what assessments take place? What do your referral pathways look like? There is interventions. So what interventions are there in North Yorkshire for those children who display harmful sexual behaviour? And then really key is around workforce development. What is in place currently that in terms of training, support, supervision in North Yorkshire around that HSB element? So the HSB framework, again, has been developed with the help of Simon Hackett, so it's all research and evidence-based, and all the statements they can be quite challenging, but they're there to provoke that discussion, and they're there to get you thinking about kind of what everything looks like locally. So this is an example of what the actual framework document would look like. The framework does actually sit on our website, and you can kind of open the document and have a look at all the statements as well that are within it. And this is what the document looks like itself. When So what's happened in North Yorkshire is by Friday, for those that there's been a dip sampling exercise that have been conducted by the Safeguarding Partnership. And those that have been identified, because we couldn't have returns from every single agency because there'd be too many. But what we need is a real good representation of the key agencies and partners across North Yorkshire. So there's been a dip sample conducted in North Yorkshire, and those that have been selected will receive information by email from the partnership by the end of the week. And when those that have been selected get that email, what you'll get is a spreadsheet version of the HSB framework and the statements. And this is what it looks like. And we ask you to capture some key information on the first screen. And then the next tab includes all the statements. Then we ask you to score, which we'll talk about in more detail in a second. And we ask for evidence as well. So in terms of the statements, each section includes an audit exercise, and it's there so local areas can assess their practice, processes in leadership against all those 5 sections. So what we ask you to do is score yourselves between 0 and 4 for each of the statements. 0 being not all, never, and no evidence for this. Up to 4, it means always, to a great extent, a wealth of extremely strong evidence for this. So we're always quite cautious when people score 4s, because what we're saying when we score a 4 is that happens and is consistent for every child in North Yorkshire. So if you put a 4, we're not saying don't put a 4. What we're saying is if you do provide a 4, we'd really be looking for the evidence to be able to justify those high scores. And if you've not got the evidence, I would kind of err on the side of caution and put it at a slightly lower score. And we can give a bit more detail about what that means. So the whole purpose is to establish what it's like right now. What's provision like right now? And this will be conducted by multi-agencies, but each team or agency selected will have a nominated lead. So each agency that is selected to complete the audit, we ask and recommend that you complete it as a group and work together to score accurately. So what we mean by that is, so say, for example, if you're a school that have been selected, we'd recommend that it doesn't just get sent to the designated safeguarding lead, because that's a safeguarding type job to do. What we really recommend is getting a collection of staff in a room for 3 hours, and I appreciate this, obviously everyone's time's really precious and everybody's really busy, but to get a really true reflection, what we need is that cross section of schools, agencies, teams, and we need everyone's view. So doing it collectively and discussing the statements is so much more accurate and provides such much more robust response for us to be able to kind of really analyse the results. So please do complete it as a group rather than an individual. And we recommend about 3 hours. It might not take that long. The key thing is if you are going to put, particularly if you're going to score anything above a 0, we definitely look for some evidence to be able to say it. So you scored it as a 2, so that's somewhat. So what does that mean? So we'd need you to describe to us what that looks like and why you're scoring it as a 2. We don't need evidence in terms of you to send us documentation or any policies or procedures. You can type it out, but if there's a policy in place, please let us know. Or if there's certain meetings that take place, again, that's evidence that that could be part of the evidence. And then just have that little check on site before you submit it. So think, is this accurate? Is everybody happy with our response before you share it with us? What's relevant? So we just talked through the 5 sections of the audit, and it's clear that maybe not every area is applicable to every organisation who's going to complete the audit. So in terms of the response, that is for everyone. And in terms of prevention, that is for anyone involved in delivering any sort of prevention measures. So that is not quite clear, but anyone involved in delivering prevention measures, so it may be, you know, those agencies who are involved in intervention also do some work around prevention as well. Assessment, now that could just sit with certain teams, say in social care or in youth justice, but anyone conducting assessments or referring into agencies that do. So if you are an organisation think, oh, well, that doesn't apply to me, please do still read the statements, because it might not be that you're directly involved in that work, but it might be that you have got experience, anecdotal experience of working with a child who's had an assessment or had an intervention and what that was like. So that can really build an excellent picture for us. Again, with interventions, that's anyone delivering or referring into a specialist service for harmful sexual behaviour, or anyone with any sort of experience of working with children who have been through some sort of intervention. And then workforce development is absolutely universal. So what's your training, support and supervision look like? Does anyone have any questions on any of that information that I've shared so far? No, nothing popped in the chat, Wayne?
No, nothing.
Nope.
So far.
That's great. No, that's fine. So what happens next? So North Yorkshire Safeguarding Partnership will circulate the information you need by Friday, the 19th of January. And for those who receive the information, don't worry, there's some guidance within that you will also get in terms of how you complete your returns and what you need to do and where you need to send them to as well. There's a completion deadline for all audit returns that have been agreed for the 9th of February, conscious that we need to get it done kind of before the February half term. So yeah, we've given the 9th of February for completing those returns. And obviously, if you've got any issues with that, or if you please do contact the Safeguarding Partnership if there's any issues. So what happens after you've completed your audit? So there will be, we will collect together all the returns. There will be a process where we are kind of validating the returns, we're checking them, we're making sure we understand them. So we'll come back to the multi-agency leads and say, is this right? Does this make sense to you? Is there might be some service or acronyms that we don't understand, because obviously you're the experts in terms of what happens in North Yorkshire. So we need to make sure we're really clear on what the information we have tells us.
Jenny, can I just interrupt just very quickly?
Yeah.
Sorry, Sarah's asked if this information will go to the head teacher in schools. I just wondered, Sarah, do you mean this initial information or kind of the results of the audit? What did you mean by that? And you can put that in the chat if that's easier. I'm assuming you mean this initial information. Or if you just want to speak, that's the audit info. Sorry, Jenny. Yeah. So the audit info. Yeah.
So if I'm not sure, Hannah's going to answer. I'm going to say it's more of a specific question. Thanks, Hannah.
No problem. So as a Safeguarding Partnership, we've got at head teacher and at DSL email addresses. So any schools that are asked to complete the audit, it will go to those email addresses.
Brilliant. Thank you, Hannah.
Right. And Joe's asked if the schools and agencies have been decided, they'd be really interested as a special school to give a perspective. I don't know if the schools have already been decided yet, Jenny.
I think it's probably a question for Hannah.
No, not yet. So after this session today, we'll be going through the attendees list and doing a dip sample. If people would like to be part of the audit process, please feel free to say that. I've noticed that certainly one other person has said that already. So if you want to put that in the chat, and we'll take that kind of into account when we're thinking about who we're going to invite.
Brilliant. No, thank you. Thank you for your questions, and thanks, Hannah, for that.
Sorry, Jenny, and just one more as well.
Yeah.
Alex was was busy this morning, so they've only able to kind of see a little bit of this. We will be sending the PowerPoint across to everyone right afterwards.
We'll be sending the PowerPoint and the Safeguarding Partnership a recording, so they will make it accessible for people to see the recorded session as well. So yeah, you won't miss anything, any of the information. What I'm going to do is I'm just going to pause for 20 seconds, Wayne, just in case another question comes up. But thank you. Honestly, please do ask whatever you need to ask. There's no, there's no kind of, you can ask any tiny questions about very specific things, or yeah, please do feel free to ask.
Okay, so I don't know if you can see the chat, Jenny. If you can, I know you're sharing your screen, but Catherine says, I recognise that this is very important, but we're in category 3 and awaiting Ofsted at 2 of our schools. So yeah, just capacity issues, I guess, around being able to complete the audit.
No, thank you for being kind of so honest, Catherine. And we recognise that there will be certain schools in similar positions and things like that. And I suppose that's kind of good to know for the Safeguarding Partnership when selecting who's going to be completed. And it's great to see some responses of people who are happy to help with the audit. So honestly, I am, we're really, really kind of excited to work with you, and impressed again about the spread of people that have attended today and the real commitment to this that's clear. There will be a pause in a second, so do kind of feel free to ask any more questions. But the next event, so unless you are part of the selected group who will complete the audit and kind of submit a response for your agency or institution, then the next big date is the 20th of March. And the 20th of March will be the dissemination event where we share our thematic findings from the responses that you have given us. And what we'll do during that session is we will share our findings for the first part, and then we will look to have an interactive element, which will probably be quite challenging with numbers this high, but we will find a way. And what we really want to do is, we obviously have our experience from a national perspective to compile the action plan, but what really kind of adds a lot of value to the action plan is having yourselves involved in sharing ideas about what you think might work, what you think might help, what actions could we take locally to improve on what we're doing. So we'll have a little bit of an action planning session. We'll capture that information, and then we'll go away and we'll produce an action plan along with the findings and your reports, and then share it with the leads and the Safeguarding Partnership. And ultimately what we'd look to do is come back in 12 to 18 months to see how you're doing, not to kind of check in you in terms of like, oh, you've not done this, you've not done that, but just to see how you're going, to see what you've done so far, what have been the challenges, is there any more support that we can give you in terms of progressing your action plan. So that is what the process looks like from our perspective. Again, I'm going to give it a second for any more questions.
Thanks, Simone. Simone's just said that the invite for the 20th will be going out this week, so everyone can get it booked in. I'm assuming everyone can see the chat, but just in case people can't.
That's brilliant. That's great. Everyone's done such a good job locally of kind of sharing what's happening as well. So thank you. So that's all from us. So you've hopefully got a nice kind of early finish, and you've got a bit of time back in your diaries. And I just want to thank you again. We will stay on for questions if anyone has any. Oh, Wayne?
Yeah, we do. Got a couple actually.
Good.
So Kate asks, do we have training materials on HSB suitable for school staff? Which I know we do. We have a whole section on our website, which I think you'll be getting the link for afterwards.
Yeah.
And I'm just going to read Melanie's out. Jenny, I don't know if you can open your chat as well, because it's quite a long one, but I'll read Melanie's out. I still have concerns around particular consideration regarding HSB and SEND children and young people. My background was safeguarding many years ago, but having worked within CYP with SEND, there are many differences in my understanding. I'd welcome more understanding with this, and whether the audit will cover special schools and other services within SEND. Thanks, Melanie.
Yeah, thanks, Melanie. It absolutely will be covered and it will be looked at and it will be included within the action plan. So hopefully you're part of a team that will be kind of sharing a response. So yeah, and it is included in the statements within the framework as well. So yeah, it is definitely captured, and there will definitely be a thread throughout. And Hannah, do you want to pick up on the training question?
So my understanding is that once we have completed the audit and gone through this process, we will be thinking as a partnership about how to share relevant training to all of our relevant agencies. So that will certainly, it will be part of the package that we develop.
That's great. I mean, if anybody's looking for any information right now, if you go to the harmful sexual behaviour section of our website, there are tools and resources and things that can be accessed. But part of this process is that consistent approach. So any sort of training that is rolled out, what we'd look to do in an ideal world is do it from a partnership perspective so that everyone's getting the same messages and it's really consistent. So there will be more to come as a part of this process from a training perspective, but there are resources out there. There's our NSPCC resources, there's the CSA Centre for Child Sexual Abuse, and there is something called Beyond Referrals for schools, which is available. So we'll make sure we kind of share those links with everybody as well. But there is resources out there to be accessed now. But from a training perspective, we'd certainly recommend that consistent partnership approach to that rollout of any training. Brilliant. Well, thank you for all your questions, and you know, we look forward to kind of working with you soon, and we look forward to getting your responses. That's all from us. Hannah, do you have anything else?
No, just to say thank you very much to you and Wayne, Jenny. I think it's a really, really exciting opportunity for people to be part of. We're kind of starting at the beginning of the process, so I'm really looking forward to seeing where we get to with this. But thank you very much to both of you, and thank you very much to everybody who's taken time out of their schedules to attend today.
Yeah, great. Thank you, everyone. So you are free to leave and take some time back if you you know, if you would like. So we will hang around for a few minutes if any more questions pop up. But yeah, otherwise, it's been great to kind of talk to you all today, and we'll see you again soon.
Thanks, everyone.